Thank you. Good evening, everyone, and welcome to the concluding ceremony of the Cataract Surgical Simulation Program, a joint venture by KSOS, Amala Institute of Medical Sciences, Thrissur, and Help Me See. It is my pleasure and privilege to welcome you all to this, personally to me, very satisfying conclusion of what was once a dream, which was in my mine and Dr. Latika's head. It has now finally come to fruition, and this entire program has been, it was almost like a, well, how do I put it? Like, a textbook case of how collaborative work can bring about huge change in the lives of our fraternity. So it gives me great pleasure to welcome our president, Dr. Thomas Cherian, president of KSOS, to this event. Welcome, sir.
Thank you.
And this program would not have been possible but for the immense help and constant encouragement by the management of the Amala Institute of Medical Sciences. I welcome Dr. Father Julius Arakel, who is the director of Amala Institute, Thrissur, to this meeting. I think Father has not joined us right now because he's traveling, but he will definitely join. And of course, none of this would have been possible but for the wonderful simulators that Help Me See brought to us. And for this, I really, I thank all the Help Me See personnel, and it is a great honor to welcome Dr. Bonnie Henderson, who is the president and CEO of Help Me See, to this meeting. Welcome, madam.
Thank you very much.
Dr. Latika is also traveling today. She is my very good friend and co-conspirator on this. She is the professor and HOD of ophthalmology at Amala Institute. Dr. Akshay Nair, the director of Help Me See, has been a pillar of strength, and he has been really, hands-on on this project. Welcome, sir, to this event. Dr. Chetan Ahiwale is the chief instructor of Help Me See, who was, pulling the strings from behind, as I should say. And all the trainees have great words to talk about the trainers. Welcome, sir, to the event. Dr. Ranjini K, who is the professor of ophthalmology at Government Medical College, Kozhikode, and Dr. Mohita Mohan, We Trust Eye Hospital, Koilandi, are the two trainees whom we have invited to speak on their experiences as trainees, right from the top, that is like a professor, to a fresh post fellow young doctor. So we'll hear their perspective as well. Welcome to this meeting. The secretary of KSOS, Dr. Biju John, who has been supportive of this venture right from the day one. Welcome, sir, to this meeting. I also welcome Mr. Ugrasen and all the other members of Help Me See and Amala who are here, and of course, all our friends and the trainees from KSOS who made this dream come true. Welcome to everyone. So with these few words, I request our president, Dr. Thomas Cherian, to give his remarks on his presidential project for 2024, which is just concluded. Over to you, sir, Dr. Thomas.
Thank you, Marin. It has been a pleasure being with this project, and let me sum it up in just 2 words: mission accomplished. A few weeks before I was to take over as the president of the Kerala Society of Ophthalmic Surgeons, Marin called me to share some of her dreams. That was about this simulator program in association with Help Me See and Amala Institute of Medical Sciences. To be very frank, I had no idea how she's going to work out this. I asked her a couple of questions. What should be the effort which I should put in as president? She said, we'll do to the best of our abilities. You please be with us. My second question was, what is the financial commitment that KSOS is going to have? Again, she said, it's nothing. So then I said, the KSOS will extend its wholehearted support for this program. And Marin started it. In a couple of weeks, she put everything in order. She discussed every single aspect of this project threadbare with Help Me See and Amala Hospital Management, got Latika on board, and the two of them have now done wonders. Something which has not been done in the history of not just KSOS, but any state ophthalmological society in India. That is a simulator-based surgical training program for its own members. Wonderful job. Let me congratulate Marin and Latika for this. And also, let me thank Amala Hospital, the Amala Institute of Medical Sciences, its director, Father Julius Arakel, and the Help Me See organization, Dr. Akshay Nair, Ugrasen Pathak, and behind all this, Dr. Bonnie Henderson. This has been a wonderful project. I've got an opportunity to talk to a couple of trainees who have undergone this training. The feedback which they gave me has been par excellence. I have only one word to say. Those who have not got this training done, they missed something. I would request the same team, Marin and Latika, Help Me See, and Amala Institute of Medical Sciences to replicate this program in the coming years. The KSOS has been proud to have this program as its presidential project, and today we see a successful culmination of this program. Thank you all from KSOS. Thank you on my personal behalf. Wish you all the best. Thank you.
Thank you, Dr. Thomas. That was really inspiring words indeed. We have Father Julius with us. Good evening, Father, and welcome to the meeting. You have arrived at just the nick of time. Am I audible to you, Father? You're muted. Father Julius? Hello? Father Julius? Good evening, Father. I think he's having connectivity issues. So in the interest of time, I think we'll just, skip one forward. And Father Julius, can you hear me?
Can we make a personal phone call to him?
Can you do that, sir?
Better.
Hello, Dr. Marin. I'm traveling.
Yes.
Maybe some connectivity issues are there.
Yes, I assume that you must be having connectivity issues. Can you just say 2 words, Father? I mean, we would be very happy to know.
Yes. Can you hear me? Can
Yes,
you hear
we can
me?
hear you. We can hear you.
Okay. Distinction. Actually, I'm traveling. That's why the connectivity is less.
No problem.
Actually, we have our institution has enjoyed this innovative program. Like, we are medical field, as you all know, is rapidly changing. Kids are arriving in our medical field. So, the faculty members and all the
Father, connectivity is very poor. I think you're breaking up. probably it was a little difficult for father to, get into it because he's on his way in his traveling. So I think we'll move on. So it is my turn to invite Dr. Bonnie Henderson to, share her thoughts on this innovative collaboration. I don't think this has been done anywhere else. And do you think this kind of program has a future? And yeah, please tell us what you think about it.
Sure. Thank you very much. And, first, I really want to start by thanking everybody. I know I wish we had an hour to thank everyone fully, but, this is such a wonderful collaboration. And I want to thank all the people that were involved, especially Dr. Thomas Cherian and Father Julius. I think the partnership with KSOS and Amala Institute has been such a wonderful partnership because we deeply respect the work that you do. And your commitment to education is really important. So I think that this really is a model of how to move forward in lots of different regions in the world, especially in India. I think you've really been a wonderful role model to develop this program together. I also want to thank our Help Me See team. I mean, Dr. Akshay and Ugrasen and Chetan and all the people behind the scenes, like Rohit, all the people that were helping, all the instructors. Again, I don't want to take up the whole hour thanking everybody, but it's such a teamwork approach and everyone had a hand in the success. I want to end by just, quoting actually Mahatma Gandhi, and, he said the future depends on what we do in the present. And I think that's really true for this example because focusing on education and how we incorporate technology and simulation training and how we train our surgeons really is going to be the game changer to improve our patient outcomes, our patient safety. So it's such an honor to be a part of this journey with you all. And I agree. I hope this is just the beginning, and I hope we can repeat this frequently. And I think just a kind of a one and done is not what we want to do. We train trainees every year, so we're going to need new trainees every year. So hopefully we could do this every year. So thank you very much.
Thank you, Dr. Bonnie. So I'll just give you all a program summary of what we actually did. Like Dr. Thomas Cherian said, I started this out with Martin Luther King's words, like, I have a dream. And I shared it with Dr. Latika, who is my very, very close friend. And the dream took wings. So in the inaugural program of Drishti 2023, the annual conference of KSOS, this saw the unveiling of a unique program in the history of ophthalmic societies in India, probably the world. Dr. Thomas, our president, announced his presidential project for the year 2023-24 as simulation-based cataract surgery training for aspiring cataract surgeons. And this was designed as a joint venture by KSOS, Amala Medical College, and Help Me See. This unique and path-making project was conceptualized, as we said, both me and Dr. Latika, who is also the editor of KJO. And this was initiated by us, but it was propelled, the project was propelled forward not only by us, the entire Amala team, the entire executive committee of KSOS, and the full support of Help Me See personnel. So a tripartite agreement was made between KSOS, Amala, and Help Me See and signed, and the details of the project was finalized by December 23. Amala Medical College provided the logistic support for housing 2 state-of-the-art surgical simulators, which was shipped from USA by Help Me See. The skill lab of the Amala Medical College was provided for the training, and on-site accommodation for trainees were also arranged by the Amala authorities. The first batch of trainees started the course on 15th of January 2024. The Help Me See eye surgery simulator is the most sophisticated ophthalmic eye surgery simulator in existence today. The course is conducted by world-class qualified instructors on-site and supplemented by course materials and online support by renowned experts as well. Training on Help Me See surgical simulator has shown to aid outcomes by 50% in novice surgeons who learned surgery on the simulator as compared to those surgeons who did not train on the simulator. So the courses offered were MSICS training, suturing course, complication management course. On popular demand, phaco training program was also rolled out from March 2024. The program concluded on 11th of April 24, and we are happy to report that all the slots were fully booked. So a total of 48 MSICS, 18 complication management course, 7 suturing, and 9 phaco simulation courses were attended by the candidates who enrolled and successfully completed their training. So a total of around 75 candidates have completed the training. And what was really surprising to us was the great demand for SICS training, especially from mid-level and senior practitioners. As Mr. Ugrasen, who just shared with us, there was exactly 50-50 percentage of senior or mid-level practitioners who wanted to polish their skills and transfer these benefits to their patients immediately. We primarily thought that it would be postgraduate students who will be benefiting maximum from this program, but we stand corrected as we realize that there is a huge pent-up demand for SICS training among our practicing fraternity. Hopefully, the next set of office bearers of KSOS will be happy to continue this association in the future and nurture the skills of our members. So this is the report of the project that we have done. Thank you all for your patient listening. Now, I would like to invite Dr. Latika. I think Dr. Biju Latika has sent her.
Yeah, I mean, Dr. Latika, I think she has expressed her difficulty to join due to the unavoidable problems.
Can you just share her message, please?
Yes.
Respected President KSOS, Dr. Thomas Cherian, President and CEO Help Me See, Dr. Bonnie Henderson, Director, Amala Institute of Medical Sciences, Reverend Father Judy Sarakin, Associate Director, Reverend Father Anthony Manumin, Secretary KSOS, Dr. Biju John, and Course Coordinator, Dr. Maureen Paul, all my respected seniors and dear members of all the 3 organizations. Today, as the curtains come down on the first simulation-based cataract surgical program in the state of Kerala, it gives me great joy to extend my heartfelt congratulations to the leaderships of all the 3 organizations involved for their vision and collaboration that has made this project a reality. Through this program, over the past 80 days, 70 course modules have been rolled out and nearly 50 cataract surgeons from all over the state have benefited. The stupendous success of this project itself points to the felt need for such simulation programs in our fraternity. So I do hope that this is just a pause in the journey. I wish this collaboration and this innovative initiative all the very best in their future endeavors towards continuing empowerment of cataract surgeons through simulation-based surgical training. Thank you.
Thank you, Dr. Biju, for sharing her message. She was unavoidably held up in a situation, so that is why she could not join us today. Now I request Dr. Akshay, who is the Director of Help Me See India, to share his thoughts on this whole program.
Thank you so much, Dr. Marian, for the opportunity to speak. And thank you, Dr. Thomas, Dr. Biju, for the opportunity to work with KSOS. I'm going to take a leaf out of Bonnie's book. If I were to thank everybody on Help Me See's part, especially our back-end team members who've been instrumental in having the simulators on the ground set up and conduct the training. Ugrasen and I are just the face, the heart, the mind, the body, and the soul of Help Me See is behind us here in Bombay. Our instructors, instructor assistants, and they have been crucial in making this happen. To echo what Dr. Marian said, even before AIOS Kochi was planned, which is in 2023. In 2022, she had called up and she said, I wanted the simulators in Bombay. And at that point, I thought of it as, to be honest, quite an outlandish project that she was thinking. And I didn't think too much on that. But kudos to her and KSOS for enabling it to make it happen. This really is a template on how partnerships can thrive in the right condition at the right time. And we have learned so much from this. In fact, we are going to use this project as our template to replicate at other places. And I believe in the time to come, you'll hear that your project has not just raised interest within other states, but also on a national level. It's a stupendous achievement, and congratulations to KSOS and to Amala for the support that they have given us. I'm just going to take 30 seconds. I wouldn't be speaking here had it not been for our team unit. Ugrasan and I work together, and equal credit goes to him for having executed this and dotted the I's and crossing the T's. Thank you so much.
Thank you, Dr. Akshay. Those were really inspiring words. Now, like you said, all of us worked behind the scenes. Now let's get down to the nitty-gritty, the persons who are actually there on the ground. So I invite Dr. Chetan Ahiwale, who was the chief instructor of LPC, to share his thoughts on what happened in this Kerala experience.
Thank you, Dr. Marin. Good evening, everyone. Good morning, Bonnie. I think I represent the training delivery team, and I think we were very fortunate to be part of this project. We feel very happy and content that we could be a part of the trainees' journey of learning surgical procedures. We trained close to 50 trainees in 70 different courses. Majority of them were SICS. And this was done in a very unique manner. Some of it was done by our on-site personnel, and it was ably supported by our instructors remotely from Mumbai. So very unique and very innovative way of delivering training. The simulator can do wonders. We have all seen that. I must mention our training delivery team members who traveled to Amla and were on site for 15 days together, or sometimes a month long duration. And so all of them who were traveled, Shruti, Sureka, Sunimol, and Pratiksha, and also our doctors who were constantly watching the training remotely and chipped in whenever their need was felt. So Dr. Kimya, who is our lead instructor in Mumbai, Dr. Tejas and Dr. Susha, who are our senior instructors. All this would not have been possible without the support from KSOS and also from the management and Amla Institute. So very fortunate to be part of this project, and not to forget the efforts by our business development team and Bonnie for supporting the entire project. So thank you all.
Thank you, Dr. Chetan. And now let's hear it from the trainees. Dr. Ranjini, who is the professor of ophthalmology at Government Medical College, Kozhikode, took it upon herself to come and check out what the training is so that she can pass on those benefits to her students. Kudos to you, madam, for taking this step. Can you please share your thoughts?
Hi, all. Madam, am I audible?
Yes, you are.
Yeah, we all learn many skills in life, madam. So when it comes to our profession, that to cataract surgery, we wish to eliminate blindness from our world. So we want to do an uncomplicated cataract surgery. Okay, so for that, step-by-step learning is a must. So when I first knew about the training program, I had a doubt how will it go, how far it will be beneficial to the student. So I thought I will explore the opportunity and I can motivate my students. That's how I registered for the training program. And so I thought I'll go through the full session and I'll come to a conclusion of my own. Okay, so about the training, I wish to share the points, madam. The registration process was very simple, and all the 4 days program were very in a stepwise manner, madam. That is like the hand-eye coordination was taught very well, and trainers were seeing that you do it in a perfect manner. That is, you become better and best, and your precision is attained at the time of assessment. So I could witness the trainees' performance and how these people are doing on the first performance and then later on. So our trainer, Mrs. Sunimo Chako, was a very good trainer with so much of patience, very good communication skills, and lovely behavior, and very passionate about her work. And this concepts to prevent intraoperative complications. It was very well explained and taught. Whereas in real life surgery, we cannot create complications. Whereas in simulation-based cataract surgery training, we can see how capsule is getting broken, or how zonular breakage is happening, how endothelial touch is happening, and how to prevent it. So even very fine movements were causing all these complications. So in real life, what we see some complications, and we try to manage that complication. But here, prevention of complications was taught well, explained well, and demonstrated, and the take-home message was by the trainees. Then Susha Sugadan madam also was very good in teaching us in practical skills and take-home messages. To add on, the space provided by the Amla team and accommodation was extraordinarily superb, and I must appreciate and I extend my sincere gratitude. And there is a long way to go for this type of simulation-based training programs. And I sincerely appreciate the effort by Ugrasen and Patak, Sinimol, Sneha madam, and all the Helmi team worldwide behind this venture. It was a great experience in my profession. I too benefited very much with this training program, and I congratulate the whole team of LBC, KSOS team, AMLA team, and the vision and the long-lasting venture should continue. And all the best, and thank you for the opportunity.
Thank you very much, madam. Spoken like a true mentor, like, if you want to teach something to your student, first you try it out. An incredible lesson in leadership, madam. Congratulations to you as well. Now let's hear from a young person, a person who, I understand you just finished your fellowship recently, right? So we have Dr. Mohita Mohan, who is working at V Trust Hospital, Koilandi. Please share your thoughts, Mohita.
Good evening, everybody. Thank you for giving me this opportunity to share my experience about Help Me See training program. As a trainee, when I experienced this virtual environment, this is the first time, I was really struck by its precision and realism. Like every details, just like the texture of the instruments, the anatomy of the eye, which was definitely gratefully crafted to mimic the reality. It was more than just a simulation. It was really a dynamic space, like a learning space, where I could make mistakes without the fear of consequences, as well as I could refine my techniques through repetition and feedback. And some of the important lessons which I learned from this program: first, how to hold the instrument properly. The next thing is reflexes, which you should be maintained throughout the procedure by holding the instruments in correct angulation, and the importance of fingers, because to make subtle movements during each step, as well as the complications. About the complications, for example, if your grip is too tight, you will definitely going to end with sonular breakage, and you can repeat so many times each procedure, and after each procedure you will be having an assessment where you among five, three should be correct, so that we can improve more ourselves. So this Help Me See training has equipped me with so much technical skills that is very much necessary to excel my profession. And I am pretty sure that this kind of simulation program will definitely revolutionize the way we learn and practice ophthalmic surgery. And I am expressing my sincere gratitude to my trainer, Sunimol, for her patience and her gentle corrections, which are definitely necessary for each step. Dr. Susha Madam for her live classes and mentorship. And thank you so much, KSOS, for this great initiative for bringing this extremely useful program to Kerala. And definitely each and everyone who is behind Help Me See. And I am very much honored to be a part of this transformative experience. Thank you so much.
Thank you, Mohita. It was wonderful to hear your comments and your learnings. It's something we can all share. And so, like they say, all good things must come to an end. So, for the time being, let's hope that this project is now, concluding here. But we hope to bring it back again next year with the goodwill of all the people involved. I think now the wheels will move, faster because people don't need convincing now. So with that, we come to the conclusion. I request Dr. Biju John, who is our Honorary Secretary of KSOS, to propose the vote of thanks.
Yeah, thank you, Dr. Marin. The President KSOS, Dr. Thomas Cherian, Director of Amala Institute of Medical Sciences, Reverend Father Julius Arakel, Dr. Bonnie Henderson, President and CEO, Help Me See, Dr. Marin Polar, Course Coordinator, Dr. Diga, Professor and HOD, Amala Institute of Medical Sciences, other dignitaries and guests from KSOS, Amala, and Help Me See, senior KSOS members, friends, and colleagues. Yeah, I'm really quite overwhelmed at listening to all that has transpired during this time in this training. I heard a lot about this, but this was really an eye-opener to hear it right from the people who trained them and from the trainees. So it's sort of, you feel sort of overwhelmed to be a part of, as Dr. Marin was telling, this is really a part of the history, and I'm really proud to be a part of this venture. And my job here is, of course, to propose the vote of thanks. So first and foremost, I would like to express our deepest gratitude to Dr. Thomas Cherian, President KSOS. It was basically his project, and he proposed it as his president's project. And he found the right people to actually go ahead with this program, as you can see from the success of this program. And thanks also for his insightful remarks on his presidential project. We are honored to have at the esteemed presence of Reverend Father Julius Arakel, Director of AIMS Thrissur, who gave us, in fact, tried to give us a good speech, but probably due to the lack of connectivity, it was not very audible. But anyway, I'm sure he will probably share his views by writing it or something. Thank you, Dr. Thanks to Father Julius Arakel. A special word of appreciation is reserved for Dr. Bonnie Henderson, President and CEO of Help Me See, whose visionary leadership has paved the way for this innovative collaboration, enriching the landscape of medical education. And thanks to Dr. Letiga, Professor and HOD Ophthalmology at AIMS Thrissur, and to Dr. Marin Paul, who are the actual personnel to whom most of the credit of this stupendous success of this program should go. They are led from the front, right from the beginning, and KSOS salutes them and thanks them. And thank you for sharing your views in this program, and thanks, Dr. Marin, for also convening and delivering the welcome speech. We extend our heartfelt gratitude to the wonderful people from Help Me See, who actually helped us to see what we are not seeing so far. Thanks especially to Dr. Akshay Nair, Director of Help Me See India, then Dr. Chetan Ahiwale, Chief Instructor of Help Me See, for the valuable contribution and for sharing the Kerala experience. Then it was really heartwarming to hear from Dr. Engineer, Professor of Department of Ophthalmology, GMC Kozhikode. Because I mean, it was an eye opener. It was really heartwarming to hear from her, how she actually wanted to experience it so that she can motivate students. It is something which I think we all would probably try to emulate. So thank you, Dr. Engineer, and thanks also to Dr. Mohida Mohan for sharing her experience. Thanks to the other trainees also for attending this program. And I would also like to thank our respected ECM Executive Committee members, Dr. Thomas George, Dr. Rajesh Umar, and so many others who are joined us through this Zoom, and many others who are actually joined through the YouTube. And thank you to all the other distinguished KSOS members joining via YouTube, the guests, the faculty members, the other participants and supporters for making this program a resounding success. Your dedication and commitment inspire us to reach greater heights. And lastly, I would also like to thank Ankit, who was our IT person, who is actually coordinating the back end of this Zoom program and who also helped in sharing Dr. Nitika's speech. So thank you all once again. I think we definitely would like to take this program to greater heights. So Dr. Marin and Dr. Nitika would probably lead us to those heights. So thank you all.
So thank you all. We come to the conclusion of this program. Thank you all. Wonderful program it was. And have a great evening. And Dr. Bonnie, have a great day. So bye, everyone. Good night.
Thank you, everyone. Thank you again.
Thank you. Good night.
Bye. Thank you.
Thank you. Good night.
Bye.